Hey everybody, it's Dr. Balcavage. We're back for another edition of Thyroid Thursday, and today I want to explain why you must fight to make sure you get a comprehensive thyroid panel done when you are getting a thyroid panel performed. Most doctors will run just a TSH or just a TSH and T4, and I want to review a case with you that just came into my office that it shows or demonstrates exactly why it's critical to get a full panel done. So the patient that came in was a 40-year-old female who has a diagnosis of hypothyroidism and PCOS. She had been to an endocrinologist, been put on Synthroid, and her TSH levels normalized. But she was struggling with weight issues, still struggling with fatigue, still struggling with tiredness and a lot of hypothyroid symptoms. And she went back to her endocrinologist to kind of check and make sure that her thyroid physiology was still good. Her doctor reran her TSH, it was within normal range, and said, listen, your thyroid is not a problem, thyroid physiology is working, eat less, exercise more, and reduce your stress load. And so frustrated, she contacted our office, came to see me. I looked at her TSH value, it was 1.5, 1.6, somewhere in that range, and her doctor was correct. Her TSH was in normal range, but obviously there was still something wrong with her physiology because she was struggling with weight issues and a ton of hypothyroid symptoms. So we ran a comprehensive thyroid panel. We ran a comprehensive metabolic panel, but we did run the comprehensive thyroid panel, and what we see makes my point really clear. Her TSH, when we ran it, was 1.65. That's normal. But her T4 is 18.6. That's way high. Her T3 is 252. That's lab high. Her T3 uptake is 44, which is really high. Her free T4 was 2.57, which is high. Her free T3 is 5.0, which is lab high. Her reverse T3, which is 30, is lab high. So remember, T4 can be converted to T3 or reverse T3. And in this situation, she is loaded with both T3 and reverse T3. And then her TPO antibodies are greater than 600. This woman has cellular hypothyroidism going on. She's not getting sufficient thyroid hormone to her peripheral cells. Part of that whole process too is she has an autoimmune attack on her thyroid gland. So her doctor, her endocrinologist, who should know that all these things are important, only ran TSH because his job was to normalize TSH. Because what's often taught is as long as TSH is normalized, thyroid physiology is working. Clearly, her thyroid physiology is not working. She's not getting thyroid hormone to the cells to stimulate metabolism, or she wouldn't have the weight issues. She wouldn't have some of the symptomatology she has. Okay, so our goal is to help her is to send her back to an endocrinologist, maybe get some of this medication modified, and then the real job is to find out why she is having this thyroid hormone resistance at the cellular level and correct that. If we correct that, then we push more thyroid hormone into the cells and we reduce that that antibody attack on the thyroid gland. The most common cause of autoimmune attack is some type of chronic inflammation, chronic infection, some type of chronic stress, heavy metals, iron toxicity, a number of factors. So my job is to help her uncover that and help her address those things and get these values back into normal range and get her physiology back on track. So again, if you have hypothyroid symptoms, you must argue or fight to get a comprehensive thyroid panel performed, and these are all the tests that make up a comprehensive thyroid panel. It's not just a TSH and T4. So hopefully that helps. If you have any questions, put your questions below wherever you watch this video. All right, take care.